This podcast is produced by OnPod, a video content studio near you. Hi, everyone. Welcome back to the podcast. Today, I'm meeting Mohcene. Welcome to the podcast, Mohcene.
Thanks for having me, Jeremy. Appreciate it.
Yeah, thanks for taking the time. I think this is going to be a really interesting conversation. So, first things first, let's talk about what is consulting all about?
Yeah, it's a very good question, and I like that we're starting with this because, I think for the audience, it's good to demystify consulting and let people know what it's all about. So, in simple terms, it's really helping clients achieve their objectives and attain their mission, whereas they wouldn't be able to do it internally because of lack of resources, whether that's financial, human, or lack of expertise. So, they bring consultants to support them through that journey. So, that's what's consulting all about in simple terms.
Yeah, so I guess it's not just the expertise, it could be also financial, like you said. It could be different aspects, because when I think consulting, I think expertise automatically, but no, that makes sense. And so what's the key trends that you see currently in healthcare?
Yeah. So within consulting, there are two streams. The advisory part, and this is where we develop strategies, we do project management, we bring the expertise. And there's also the implementation. So this is more technical, where we implement softwares, technologies, and drive that innovation. And within healthcare, AI obviously is the biggest thing in every industry now.
It's huge, right?
Yeah. It's amazing, and also in healthcare, it's a big part of it. Um, and AI, I see it as a problem solver for the issues that we currently have right now, but also a drivers for the innovation. So they go hand in hand and they align perfectly. For example, we can use AI in routine administrative tasks. That's very simple, and to more complex diagnoses. One example is when you have a medical visit with your family doctor.
Yeah.
They may spend 1 hour with you, but they're also taking notes. And after that 1 hour, they tend to spend 2 hours on average just doing admin tasks. So when you add AI to this, it will add a lot of efficiencies. I'm also excited about a lot of other trends that will be driven by AI. The first one is the shift from hospital to remote care. So the hospital will be the last point of contact where you're going to receive care.
Yeah.
Unless you want to, there's a emergency procedure or in-person consultation, then, you will have to go there. Other than that, it will be more remote.
Do the healthcare system, are they scared about AI? Like, are they happy about it? They scared? Are they like, is it well received?
Yeah.
Because it's a hard thing right now, right? AI, is it well received? Like, some people love it, some people like it less.
Yeah. That's a very good question. And I think the short answer is it depends.
Yeah.
It depends on who you're talking to. Some people might experience resistance to AI, but others are really embracing it because they see the difference. They see what AI can do to their day-to-day tasks, and it makes their life easier. For example, now, the focus of healthcare should be on the patient outcomes.
Yeah.
And now with AI and with the remote, monitoring devices and wearable devices like your Apple Watch, there's more data generated. So within this data, we can actually use it and leverage it to tailor our clinical recommendations to the patients.
Yeah.
So we would have more tailored, approach.
Yeah, that's interesting. My dad is diabetic, and he has this new sensor.
Yeah.
Well, it's not new, but it's newish. It's always it always comes in Europe first, and they have these new sensors, and the sensors sends the data to his phone, and he has alarms, and and all that data after that, I presume, like, later on, we'll be able to just, AI is going to be able to take all that data and help diabetic people better understand how this works, right? I think AI is going to be a good thing for that.
Of course, it helps with that personalized approach because every person is different. There are multiple factors that will determine your health outcomes. That's your lifestyle, your genetics, whether you're predetermined to have a specific illness or not. So there are multiple factors, and we shouldn't have a one size fits all. I think we should have tailored approach for each individual to maximize that outcome. So with more data, with cleaner data that is leveraged by AI, we are getting there to this goal.
Yeah, because I think in the past it's almost too long to track and see all this data and analyze it. by hand, or visually analyze everything. Now AI can do that much faster,
Yeah.
which is really great. Um, what's the biggest challenges innovation teams faces when turning strategy into action?
It's a very good point. I would say the biggest challenge is not coming up with innovative ideas. It's really making them stick into a system that is fragmented. Here in Canada, we have provincial health systems, but even within the same provincial system, we have silos and fragmentations. So there are different teams and organizations doing amazing stuff, but they don't communicate with each other. So it's not one united effort that would push us to improve the system. So that's, I think, the biggest issue that we're seeing right now. Thankfully, there is a big trend of interoperability that's coming up. In simple terms, it just means that you have two systems that are connected and talk to each other. I'll give you a simple example. So if you break your arm or if you need a procedure and you go to the Ottawa hospital, um, and you receive that treatment, and later on, you develop a mental illness and you need to
Mm,
be transferred to the Royal Ottawa Mental
yeah,
Institute.
yeah,
Well, your data does not necessarily go with you. So there's,
yeah.
silos and the systems don't connect. But now there is an improvement, and
Hmm.
it's getting better and better.
Yeah, obviously, like we're talking about Canada right now, and different countries have different system. I was living in another country, and I found it so cool that I went to do a blood test, and they sent me through WhatsApp
Yeah,
the blood results within an hour,
yeah,
and then I send that to my doctor. Versus here, it's in Canada, they would send it to the doctor, and then the doctor would call you, and then so obviously, hopefully, these systems will become more and more working together and easier to access and all that stuff. Because I think sometimes it's almost hard to access your own data,
yeah,
right?
yeah.
Certainly in Canada. Um, but I think it's coming. Can you talk about Lean Six Sigma and what that plays into innovation today?
Yeah, absolutely. So, for the listeners that don't know, Lean Six Sigma is basically a methodology that uses data, tools, frameworks, and other approaches to optimize business processes. And I like to picture it as the structure behind the chaos. So, really bring structure to innovation. And, I'm a black belt certified Lean Six Sigma. So,
Okay,
there are different belts from white,
that's
yellow,
interesting.
blue, green, and black.
Okay,
The black, it means that you can drive the project from A to Z,
okay.
and you can supervise green belts. And basically, we leverage tools like the Kenrin, the Harshi Kenrin, the DMake, the business process workflows, and really to identify where the gaps are,
Mm-hmm.
where are the wastes and the inefficiencies, and we come up with solutions to improve those inefficiencies. So, to give an example and really clarify what Lean Six Sigma is about, I worked on an amazing project just across the river from us in Quebec, where we worked with a department in a big health authority, and they wanted to implement a CRM, so a customer relationship management
Mm-hmm.
system. And we did a current state assessment where we mapped all their processes. And for example, they would do clinical assessment in pen and paper. They would
Yeah,
put it in one system
yeah.
and then put it in another system because the first one does not communicate with the first. So it's a
No,
lot of inefficiencies.
sounds a little bit like the government sometimes.
Well, it is government,
Yeah,
right?
yeah,
So it's
yeah,
a
yeah.
public
Well, yeah,
sector. So
yeah, yeah.
yeah,
But it's like, yeah.
yeah. So what we did is after post implementation, after we really streamlined all the processes,
Yeah.
now those clinical evaluations are done through the system once.
Mm.
They give you the results, the interpretation of the results, and also what's super cool about it is it gives you the trends. So you can see in a graph whether the patient outcome is improving or not. And they can also do a lot of other cool stuff like automating emails, follow-ups, appointments with patients. So post implementation, we saw the wait time in that department going from here and dropping exponentially. So it was amazing.
Yeah, because it's all about organization, and I think healthcare is one place that we should push for the fastest innovation that we can to be well organized and better have a better care for the patients, right?
Yes,
Because yeah, I think healthcare is the place to be. If you want innovation, it should be there to really
absolutely.
help people. Um, when you're brought into lead transformation, specifically for healthcare, like what's the first thing you kind of assess or go through?
Yeah, very good question. In every project before starting as a consultant, I like to look at three main factors. The first one is leadership intent and governance. So why are they doing this project? What's their vision? What did
Hmm.
they structure to achieve that objective? And also in terms of governance, how did they, structure their team? Who's on the hook? Who's responsible? Who has influence? Who has authority? Because this will help you tailor your approach accordingly to really make the project successful. The second point, in terms of innovation, you need to look at the infrastructure readiness. Is the infrastructure, by that I mean the current softwares and tools they use, are they mature enough to endure that transformation? Is the IT department knowledgeable and competent enough to
Hmm.
support you with that?
Yeah.
And the last point, and I think the most important one, is to check the culture pulse. What's their risk appetite?
Yeah.
Are they open to change or
Yeah.
not? Are they embracing it? Are there any champions? Because
Yeah.
they will be the end users, right?
Yeah, and that's hard because you look at I was working at CBC, and a lot of people were like getting close to retirement, and
Yeah.
they're less inclined to learning new things because like they're close to retirement. I get it,
Yeah.
and so it can be hard depending, I guess, the age group, or like the people that are more like not necessarily age group,
Yeah.
because that's not necessarily like
Yeah.
anybody can want to learn and change things, but I feel like that could be a big hurdle, right?
Yeah.
To have a good acceptance rate
Yeah.
into that new system or
Yeah.
idea that you bring, right?
Specifically in healthcare,
Yeah.
a lot of staff are overworked, and we know there's a shortage of staff.
Yeah.
So you don't want to add, another learning session on how to use a tool that
Yeah.
might not even make it more efficient for you. It just adds admin burden.
Yeah.
So this is where I think the resistance comes from.
Mm.
But when you have a strong change management strategy and you apply it, and you have champions that would vouch for the solution, and they can actually see the results, that it's not adding burden, it's really making their processes more efficient, and they would have more time for the patient and to be present with the patient.
Yeah. Yeah. And I guess you really need to explain that we're not just adding another tool, right?
Yes,
Because that's the worst thing.
absolutely. Yeah.
Yeah. What's one misconception business leaders have about digital strategies?
So one thing that I found, and I think the biggest mistake that the biggest mistake that occurs when it comes to digital transformation is we're trying to build solution for the people without necessarily building it with the people. So that concept of co-designing with the users,
Mm-hmm.
involving every stakeholder from day one, whether those are clinicians, management, staff, administrators, because they will give you their reality, what is doable for them, how they can benefit from the tool, leverage it to the max. So co-designing from, step one, implementation, maintenance, post implementation, those are all important, because again, you will have a tool that reflects the reality, that is adaptable, that is scalable, but also that is welcomed within the end users. So if they lack co-designing and involving the right people at the right time,
Yeah.
the success rate is going to be low.
Yeah. How do you make it that, it is going to be a success, and people are going to be welcoming it? Do you have like a strategy to make sure that people are welcoming the change?
Yeah. Having champions, I
Yeah.
think that's number one.
Yeah. Finding the right.
Finding the right person that's very enthusiastic about it, that's excited about it,
Yeah.
because they will influence their colleagues.
Yeah.
Making it also simple and adaptable to the current systems. It's not going to be a drastic change. It's going to be small changes. And the agile approach of doing it is amazing,
Hmm.
because, whether in project management or in software development, you have iterations, which we call them sprints.
Hmm.
And first, you build the MVP, the minimum viable product, which is basically the foundation of your house.
Yeah.
And then you do iteration, sorry, where you build a wall, a window, a door. You make the house more livable, and in technology terms, more adaptable to the end users. So
Mhm.
when they see that it actually benefits them and it helps them, then you will have more acceptability.
Yeah. Then they're more open to it,
Right.
right?
Yeah.
And yeah, that's really interesting. What do you see, in 5 to 10 years in the healthcare system? Do you see massive changes? Do you see a lot of AI integration? It's like, what are we seeing? Because I've seen, it's funny, I've seen an article, I think in China, they have like these like robot doctors, and they're, I mean,
Yeah.
there's a lot of stuff that's
Yes.
coming out, and just going on ChatGPT and asking like my knee hurts like this and that, and that,
Hmm.
it kind of gives you like a lot of stuff, which
Yeah.
is not good and bad, but what do you see in the future? Like, do you see a lot of um AI involvement into healthcare?
Yeah. I think AI will be present and it's here to stay, obviously.
Mm-hmm.
It's not going anywhere. I think within the next 5 years, we will flush out all this hype because there's a lot of, flashy new tools that are very attractive to people. But, before doing any proof of concept or pilot project to show that they actually work within the reality of each
Mm-hmm.
health systems in our country, then it's going to be really hard to push for it. But yeah, there will be a lot of AI tools involved. Access to care will be more facilitated because of AI. So there's less barriers to access
Mm-hmm.
and more tools for tailored approaches. There's also going to be more patients managing their own care because
Yeah.
they will have access to resources,
Yeah.
to tools that are powered by AI that will help them with this.
Yeah, and maybe virtual doctors a lot more. Well, hopefully, faster access to care,
Right.
and easier to manage your own, I don't know, your own prescription, your own care, like having an app to see everything what you went through, like access to information, to your own information,
Yeah.
and shareables, right? I think if it can share from a hospital to another one, to another province, another city, I think that would be great, right?
Yes, yes, exactly. And you touched on a good point. So even from the patient side, they will have, more authority towards their care, but also from the clinical side, I think we're also seeing shifts in responsibility. So nurses now can take more responsibilities. It's not
Yeah,
like they don't do a lot; they do a lot, but
they
they
do a lot.
are
Yeah,
more authorized to do, other procedures. They're
yeah,
also looking at pharmacists.
yeah,
They can prescribe and have more authority.
yeah.
So restructuring that authority phase and sorry, restructuring the authority responsibilities for each clinician is very important now.
Yeah, super important, because there's some stuff that it's like, okay, you need to see a doctor for this specific pill, but it's not like, it's like you've had it every year or something, and you go see the pharmacist. The pharmacist like feels really bad. He's like, he wants to help you, but he's not a doctor, so he
Yeah,
can't really. So you gotta. So then the process is maybe too long sometimes, right? And there needs to be like, imagine just, okay, I need to see a doctor, virtual doctor, and then send the prescription to my pharmacy,
yeah,
like a faster way to do it. I think there is a faster way. We just need to, like you said, like organize it and systemize it in a better way.
exactly. I think you've put it in great terms. Yeah,
Yeah.
yeah.
Well, thank you. I think that's it for today. And yeah, anything you want to add before we finish?
Well, if I would like to leave the audience with a message is that digital transformation in healthcare is not always about technology. It's really about the people, the purpose that's driving us. We're working very
Mm-hmm.
hard on strengthening our healthcare system, and over the years, I had the opportunity to take part of very interesting projects with health systems, hospitals, ministries of health across the country. And we keep doing this in our consultant firm. So if your organization is feeling stuck or if you're losing momentum doing that technology implementation, feel free to reach out. I'm more active on LinkedIn at Mohcene Abdessemed, or feel free to visit our website at abmoconsulting.com. And hope the listeners benefited from this episode and had something to learn.
Yeah, I think so too. And I think, you're such in a great space, as a consultant in technology, healthcare. It's like people, like, I feel like we need you. You know what I mean? Like
Yes.
Canada needs you, like but
Yeah.
like it's such an important place to be. Uh
Exactly. And when I look at problems, like we have some serious issues in our healthcare, I
yeah,
like to
yeah,
see them as opportunities to improve.
yeah, yeah, 100%.
So when you have this perspective, I think it helps a lot with your job as a consultant.
Yeah, because you have a really nice base, and now, it's easy to say where the issues are. and now it's not simple to fix, but it is fixable. We just need to take that step and do it.
Exactly.
Right.
All right.
All right.
Thanks,
Thank
Jeremy.
you so much.